COPD is diagnosed based upon a variety of factors and assessments. I will assess your symptoms, your medical and family history, and review your exposure to lung irritants. I may have recommended some tests to help diagnose COPD and exclude other possible conditions that could be causing your symptoms. Once we excluded these other possible conditions, COPD was diagnosed with breathing tests of your lung function. Lung function tests measure how much air you can breathe in and out, how fast you can expel the air, and how well your lungs deliver oxygen to your blood. The main diagnostic test for COPD is called spirometry. This is the breathing test that measures how much air you can blow out and how fast you can blow it out. The results help me diagnose COPD and determine its severity, or if another condition may be causing your symptoms. I may measure the levels of oxygen and carbon dioxide in your blood to determine whether you need oxygen therapy because your oxygen levels are low. This is done through a blood test. People with COPD typically show lower levels of oxygen and higher levels of carbon dioxide. This is because people with COPD have difficulty getting oxygen in and expelling the carbon dioxide out from their lungs. The results from this blood test can help in evaluating the severity of your COPD. I may also request a chest X-ray or a CT scan of your chest. These tests create a picture of the structures inside of your chest and can tell us if your heart, lungs, or blood vessels show signs of COPD. These pictures are also useful in determining if your symptoms may be caused by another condition. When you've been diagnosed with COPD, it's important that we work together to help prevent further complications and to help slow the progression of your disease. If you smoke, the first and most important step you can take is to quit smoking. Smoking is the leading cause of COPD in the United States. Most of the damage to your lungs is caused by the continuous cycle of inflammation brought on by smoking. The health benefits from quitting smoking are immediate and long-lasting. 8 hours after quitting, the carbon monoxide level in your blood drops and the oxygen level in your blood increases. Just 48 hours later, nerve endings start to regrow and a sense of smell and taste begin to return. Circulation, coughing, and shortness of breath all improve within that first smoking-free year. 10 years after quitting, the risk of developing lung cancer is about half of the risk of a person who still smokes 1 pack a day. Quitting now can help you be healthier overall and help you meet the challenges of COPD. I will work with you to find the best smoking cessation plan and support for your situation. Take as many steps to stay healthy and active as you can. It is important to consult with me before starting an exercise plan. Although there is no cure for COPD, there are treatment options that can help manage the disease. Through a combination of medication and self-care techniques, we can work together to help make a difference in your breathing and keep your disease from progressing. I may recommend one or more of the following non-medicinal COPD treatment options. Pulmonary rehabilitation is a structured program that can reduce symptoms of COPD. Depending on your needs, a pulmonary rehabilitation program might include exercise training, nutrition counseling, and education on special breathing techniques and other means of coping with COPD. We can discuss if this program is right for you. Regular exercise can increase your energy levels, improve your circulation, reduce symptoms, and increase your endurance. We can work together to determine how much physical activity and what kinds of activities are best for you. These might be stretching exercises, an aerobic exercise like walking, or other exercises aimed at strengthening your muscles. Oxygen therapy is another treatment option for people whose COPD is very severe. Oxygen therapy may improve exercise endurance. Surgery may be an option for some people with very severe COPD. In addition to these non-medicinal treatments, I may recommend one or more medications that may help make your breathing easier. Two primary medications frequently used to treat COPD are bronchodilators and inhaled corticosteroids. Bronchodilators work by relaxing the muscles around your airways. This allows more air in and out of the lungs and improves breathing. Short-acting bronchodilators are usually only used for sudden COPD symptoms. Long-acting bronchodilators are prescribed for everyday use. Depending on the severity of your COPD, I may prescribe both a short and long-acting bronchodilator. These medications are taken using an inhaler, which allows the medication to go directly to your lungs. Some side effects from short and long-acting bronchodilators may include a nervous or shaky feeling, overexcitement or hyperactivity, and increased heart rate. If a patient has severe COPD symptoms, I will prescribe an inhaled corticosteroid with a long-acting bronchodilator. When used correctly, inhaled steroids are breathed into the lungs and may help to reduce the inflammation or swelling that is an underlying cause of COPD symptoms that can make it difficult to breathe. We may test inhaled steroids used with a bronchodilator for about 6 weeks to 3 months to see if it helps you breathe better. You should know that there are different types of steroids with some important differences between them. Inhaled corticosteroids are breathed into the lungs and reduce inflammation in the airways. Side effects from inhaled corticosteroids may include bruising, oral infections, and hoarseness. The pill forms, like prednisone, are taken orally and reduce inflammation throughout the entire body. Oral steroids can have serious side effects, such as weight gain, diabetes, osteoporosis, cataracts, and increased risk of infection. Colds, the flu, and other respiratory infections can cause problems for people with COPD, so it's important that you do your best to avoid them. Because flu shots can reduce your risk of getting the flu, and the pneumococcal vaccine can lower your risk for pneumococcal pneumonia and its complications, I may recommend that you get vaccinated.